Paul Wheeler first started noticing his hearing loss more than 20 years ago at work.
It is a little bit tough when you work corporate. It just doesn't work when you're in a meeting and you miss something.
Despite hearing aids, Paul's hearing kept declining in both ears, and he had to take an early retirement. His family has been incredibly supportive, but interacting in general became increasingly challenging.
Sometimes people talk and they talk in a group, and then you're like, they talk about you like you're a third party, like you're not even there kind of thing.
Sunnybrook surgeon Dr. Vincent Lin says Paul was a perfect candidate for a cochlear implant.
This is the squamous temporal bone, which is very thin, but we're going to recess part of the implant up here.
Okay.
And then we're going to...
Unlike a hearing aid, a cochlear implant is a surgically implanted device that delivers impulses directly to the auditory nerve, which carries signals to the brain. And today, Paul is the 1,000th patient in Sunnybrook's implant program to get a cochlear implant. The adult program is the largest in Ontario and the first to reach the 1,000 patient milestone. Dr. Lin says the number is significant, knowing patients with hearing loss have higher rates of social withdrawal, job loss, and depression.
And so the benefit of our patients is that they can resume normal life. They can go back and speak with, with their family. They can speak to their wife, their husbands in the car. They can talk on the telephone. Small things that we don't realize how important are to us until we actually lose it.
Okay, Mr. Lynch, we're ready to start.
Long, none.
Don Lynch got his cochlear implant 2 years ago, and while it normally takes some time to notice improvement, Don says he could hear instantly.
I couldn't stop it. The tears are coming down. I said, I heard that. Even if it takes you a year or more to get where I was after a month, it's worth it. You can rejoin life.
It's this type of reward that makes all the time spent with each patient totally worthwhile, says David Shipp, coordinator for Sunnybrook's cochlear implant program.
We spend a long time counseling patients to ensure that if they're going to undergo this, that they understand what's involved. So really from the time that they see us until they actually have their surgery can be anywhere from 6 months to a year at the moment.
So this part is the part that I buried into the skull. This is called the receiver stimulator. And this is the little computer that will be sending sounds down this wire, okay, in this little loop into the cochlea.
1 week after his surgery, Paul is back at Sunnybrook for his follow-up appointment.
This is very, very nice. So I'm very happy how this looks. Now we do the
Dr. Lin and his team are currently involved in research to make the next generation of cochlear implants even better, so that patients can not only hear voices, but also better appreciate sounds like music, which uses a complex set of frequencies.
And I think we also look forward now to next 1,000 implants, because we know that with the upcoming technology advancements, how much better the devices will be in 5-10 years.
With Sunnyview, I'm Monica Mattis.